Hello everyone, I hope you all are well and enjoying your weekend. Today I'm here with the episode 2 of Hello, my name is Dandruff. I'm just going to wait for a few seconds because we are having a lot of questions, and sorry, not questions, we're having a lot of comments from people that they just want me to wait for a few minutes before I start the actual live. So I'm just going to wait for a few more minutes for other people to join in. So thank you so much for liking the first episode and for the fantastic feedback. It's really helpful. At the same time, I have received a lot of questions, which I am going to answer. Most of them I'm going to answer today, and from here, whatever we're going to generate, I'm going to answer it in the next episodes. Okay, so another few more minutes and then I'll start the episode. So the questions, most of the questions, they were around how do I know what to do? Because it's a series, so I cannot, as I've mentioned in the first one, I cannot finish the whole chapter, the whole topic of dandruff in one episode anyway. So there will be more episodes coming where we purely will be focusing on the treatment, what to do, from mild to moderate to severe. And then we will also be focusing on what remedies are available. You can do it at home. And then I will be covering, because I have received many questions about children, what to do in that situation. So, hi Tanya. So I will be covering that in a totally separate video, because or in a different live, because that's sometimes the treatments are very different in children. Okay, so let's start the episode 2. So the questions, I'm going to start with the questions first, and then we'll just talk about some home remedies which you can use and which can help. Again, the question was what exactly the dandruff means, because I have mentioned it is an uninflamed. Hi Osama, good to see you as well. So the question was that what exactly the dandruff means, and I have mentioned that it is an uninflamed part of seborrheic dermatitis. So does that mean it is same or is it different? And does that affect the what people suffer? So there were like 10, 20 questions purely based onto this thing. Okay, so let's simplify that. As I've already mentioned, seborrheic dermatitis is a big chapter. Now, that usually we consider when you have an inflamed scalp. If it is not inflamed, then it is dandruff. So dandruff, in simple words, when it becomes moderate to severe, we are talking about seborrheic dermatitis as a rule of thumb. So does it matter? Yes, it does matter. I already tried to cover that, but let me simplify it again, because that is the most difficult thing to explain to the patients or to the clients. So if you focus on inflammation and the uninflamed part of it, so easy to remember, inflammation, which is similar in acne, which is similar in any inflammatory skin condition. Flame actually causes irritation, it causes heat, it is red, it is hot, and it can cause swelling. So any condition, skin, or which affects any part of the organ which is inflamed or which is inflammatory in the origin, the root cause, you can have all of these things. Now, if it is an uninflammatory condition, it means that that can progress into an inflammatory condition. So if you have, say, for example, in dandruff, what is happening is that you have this fungus which is sat there for quite some time. Now, this fungus is starting to misbehave a little. So if you're not going to control that, that can then get out of control and can spread and then formed an inflammation anyway. So this is going to precipitate it. So does it matter? Yes, it does matter, because it is mild, moderate, and severe. Similarly, like inflammation, you can go into any category. And because these are the conditions which we cannot cure it, these are lifelong conditions, we can only control the symptoms. So depending on other factors, because that was another 5-10 different questions onto that how exactly we're going to control it. So yes, the treatment I'm going to talk later, but if you then divide it into the severity and the site where exactly it is, and then what kind of profession you are in, because certain professions or certain sports can also make it worse. So you can then precipitate it. So the root cause is the same. It's just the progression of the disease which can then define, do you have mild dandruff, or do you have seborrheic dermatitis, which is a kind of a full-blown. Okay, so I've kind of answered all of this thing. And why I have that. So I've tried to mention, we don't know the exact cause of dandruff or seborrheic dermatitis, why people get it. However, so I'm just going to answer that question in a second, Sama. So sometimes people say that, okay, sorry, back to my question, which I totally forgot while reading that. So does it matter? Yes, it does matter, because we don't know the exact cause of it, but that does not mean we don't know the treatment to that as well. Because it's an inflammatory process. Hi, A. So it's an inflammatory process, so we have to then work accordingly. So what I'm trying to explain here is that yes, the bigger concept we don't know, but then we are aware that this is one of the fungus or the yeast which loves to sit there. And if we can't control the fungus, it is then going to progress. So yes, we know at least a bit of a cause where we need to work. Now, fungus or the fungal infections, those who have ever suffered with it, they're the most stubborn infections to go away from your body. Fungus kind of, we call it like a silent observer. It sits there and it slowly gets into your organs or your skin or wherever, and then it tends to stay for longer. So sometimes when you can't see the visual effects, the fungus is still there. And that's why it's important to treat that for a little bit longer. Something what I tend to kind of explain is a maintenance therapy, that you have treated something and then you have to maintain it because you have not cured the cause 100%. That's where the people get stuck with that. I can't see it now, it's done. They stop everything and they go back into the cycle. So it's an intermittent, it's a remitting and relapsing kind of a condition, which means you have to be prepared for it. It's like, winter is not one-off. Winter is going to come every year. So depending on how bad it was, depending on your circumstances, your environmental factors, your personal factors, your health status, and the stress, which is really, really important, you have to, it's a package. It's not like one-off you have picked up from the matchbox and you've kind of, lightened that, burned it, and it's going to go. It does not work that way. So I hope this clarifies that once you've treated it, why it comes back again, because you have not treated it completely. So you need maintenance there. And we will talk about that in a separate treatment video. So the other question was, I am stressed out and my doctor has mentioned, but sometimes in stress I get bad dandruff, sometimes I don't get dandruff. Okay. So in terms of that stress, if you go back into one of the videos of mindfulness, which I've done, where how stress affects your skin and your oil producing glands and other parts of your body, it actually covers a lot there. But just to kind of touch base it, when you're stressed out, the stress hormones are in your body. They're not meant to stay there for longer. But because you can't get over it, so your body starts absorbing that as normal part of it. Stress hormones increase the amount, sorry, not increase the amount. It works on the oil glands in a way that the production of the oil becomes thick, difficult, and the oil gland starts firing at a higher pace. So that is then not going to help with that. At the same time, during the stressful situation, you have a lot more sugar which is available in your body, and because your brain needs this buzz effect in order to kind of cover that emergency situation. So fungus loves the sugar levels. That's why usually the fungal conditions are more common in people with a background of diabetes, and we usually check that. If you can't, so I usually, whenever I see a fungal skin condition or any other which is kind of coming back and back, I always have to make sure that the patient is not diabetic. Because we have to stop a bit of a feed to the fungus. Fungus loves that. So that explains the stress situation, the level of stress that explains, and how good is your coping mechanism in terms of that. Then hygiene. Okay, so there were so many questions about that. So let me clarify. I did say that when you see somebody with seborrheic dermatitis or dandruff, it does not mean that they have a poor hygiene. So I did not say that it does not mean that you don't have to look after your hygiene. They're two totally different things. Now, when people, and this is, we have something what we call a DLQI, which is basically just gives us an insight into how skin conditions are affecting someone's life, daily activities, and how much that has a knock-on effect on their mental health. So many of the patients over there, they actually tells that when somebody has got a visual, and there's a lot of evidence as well, when somebody is suffering with a visual condition, the people at the receiving end, they don't know much about it, and sometimes it's very easy for them to label these patients or the clients as this is because of they have a poor hygiene, and they stop talking, they stop interacting with these people, which actually is going to make their life more difficult. So the reason why I mentioned that is because if you see somebody suffering with this condition, it's not because they have poor hygiene, but that does not mean that somebody who's suffering with it, they don't need to look after themselves, and they don't have to shower, they don't have, because it's not it's not an unhygienic condition. So these are two different things which I was trying to explain. So in simple words, if you have a poor hygiene, it's not going to help you. It will precipitate your dandruff and seborrheic dermatitis. So you have to look after it. You have to wash your hair. You have to, do it more frequently. So that's the answer to this question. Okay, so the longer you go, okay, so my doctor has said that there was another question. My doctor has said the longer you go in between shampooing, the flakier your skin will be. However, if I shampoo more often, that actually makes my skin dry. What to do? Yes, so this is really, really important. And that's, I think we're just going to focus a little bit onto that. As I've already mentioned, dandruff is because of the excessive oil. So the fungus loves to eat that oil and the dead cells of the skin. As a result, it actually increases or makes the skin cycle faster because it needs... Hi, Ru. My nephew is watching and, he's just sent me a message, which I'm really happy with. So, okay, so then it increases the process of skin cells. So when there is more oil, then more dead cells, fungus is going to eat, and then it will kind of regenerate faster. So as a result, it's really important that you need to maintain a bit of a balance. Now, balance could be different from one person to another. If you are somebody who's an athlete, which we will be covering a lot in our skin and sports video blogs, the series which is hopefully about to come in, very soon. So I will be covering that. But the rule of thumb is that you have to wash your hair frequently, because if you're not washing your hair, you're leaving a lot of oil and the dead cells. Now, do you have to shampoo every day? You don't have to shampoo every day. This also depends on the severity of your condition. And it does not only affect your scalp, it affects your, and that's also answer to another question. So it does not only affect the scalp, it can affect your chest, your shoulders, your eyebrows, your ears, your armpits, your groin area. It can affect all of these parts. So sometimes when we see inflammatory skin conditions on the chest, one of the commonest cause of that is dandruff and seborrheic dermatitis. So then I have to treat the scalp in order for me to cover or treat the rash on the chest. That's really important. So that's the answer to that question. Find a balance. And again, moving forward, we'll be talking about if you have mild dandruff, what to do, how often you can, shampoo and do all of these things. Okay, so there is just one question. Some doctors say you do not need to use these shampoos. Most of the dandruff is necessary for head, which is washed away by these shampoos. Is that true? Okay, Sama. So that's a really good question. Answer to that question is, if you have dandruff, you need to wash your scalp more often. That's the answer to it. Yes, finding the balance is important. Now, oil, you cannot stop, oil in your body. There are so many oil-producing glands anyway. So even using the shampoos, it does not mean that it is going to stop the oil production forever. So you're using that and the effect is only going to last there for a few hours and the oil is still underneath. And then the other factors, they play an important role as well. So the amount of, and the oil glands are present everywhere on the body, not only on the scalp. So yes, the answer to that question is, if you're washing it every day and you have a mild dandruff, it can cause dryness. Dryness sometimes can precipitate inflammation. So you just have to find like 3-4 times or sometimes even 4 to 5 times washing or 4 times shampoo in a week is enough as well. Medicated shampoos, yes, they are better, but we will talk about this in a separate episode. So this is actually the answer to your question. I hope that makes sense. If not, send me another one and I'm happy to answer that. Now, okay, so moving forward, I don't want to make it too long. Moving forward, Signs and symptoms. How do I know this is dandruff? Okay, so as I've mentioned already, inflammation, non-inflammation, you have to, look for these signs. Your scalp can be sensitive, itchy. You can feel swelling on the scalp of different parts, or the whole scalp can be swollen. You can feel it's kind of quite sensitive to touch. Combing your hair could be a problem. Sometimes you see a bit of dandruff coming off, which could be white to yellow to simple kind of, screen-like, very little, or big patches or flakes. You could sometimes see it on the shoulders, sometimes see it only on the scalp. Other way, if somebody has got really itchy ears constantly all the time, 99% they have a seborrheic dermatitis or a dandruff of the scalp, which is shedding and going inside the ears. So cleaning the ears or going for the waxing and these kind of things is not going to help. That's another way. It also affects very common, so seborrheic dermatitis is, again, if it's moderate to severe, about 80% people, they also develop a lot of dryness around their eyebrows area. And just these around the nose, because if you see, there's a bit of a pit where the dandruff sheds and it loves to sit there. They also can have a problem with the beard, so just cover that. And behind the ears is the commonest part of the seborrheic dermatitis or dandruff, loves to sit there. So these are the symptoms, these are the places you can pick up. Now, I've already answered most of these things. Okay, now question. Today, what are we going to talk about? So I'm just going to talk briefly about lemon. Lemon is something which is quite cheap. You can use it at home, and it does wonders not only to the skin, but it also does wonders to your scalp and dandruff. So what is lemon? So lemon is one of the brilliant, I call it item, because it is fully packed with so many things. It has, and it's an antioxidant. It is antimicrobial, which means it fights against the organisms, and that is the part where it fights against fungus, and it's really, really good. Along with that, it is packed with vitamin C. Now, vitamin C is really important. When you are stressed out, your body eats a lot of extra vitamin C. And lemon is fully packed with it. What else? So it is an essential vitamin anyway. So using lemon, you can control a lot of your dandruff. Now, how to use lemon, that's really important. So somebody has sent this message that they are using lemon, and whenever they put lemon to their scalp, it burns. The reason it burns, because it has got citric acid in it. So if you put acid onto a place which is already inflamed, you are going to get burning. That's the knee-jerk response of your skin, because it's already sore and raw. So then there are a few ways you can use lemon. You can either mix it in honey. Honey is good. It has an anti-inflammatory effect, and it's very good for to get rid of the dead cells. So it's a good exfoliator as well. Similarly, lemon is an exfoliator too. So if you remember in this one, we have a lot of dead cells which are stuck there, packed there, and we want we're using a bit of an acid, and we're using the exfoliating bit, and working together. Yes, it is going to work. Okay, so how you can use it. Now, the lemon and honey paste, you can make it at home literally, but use it like 1 to 3 proportion. So don't use lemon more than 1 part of that whole mixture. And when you're applying it, you don't have to literally apply it everywhere on your scalp. Just have to apply it in the roots. So just a little bit, take a brush and just literally paint it in your roots, and that's enough. Leave it for 15 to 30 minutes. If you have a sensitive skin, maybe 10 minutes or even 5 minutes is enough as well. You don't have to kind of push it further. The longer you're going to push it, the more irritation and burning you will get from it. That's one way of using it. The other, you can add egg into lemon as well. Similar, just 1 teaspoon of lemon juice you can add, and maybe 1 or 2 eggs, depending on how big your scalp is, and just literally apply in the roots. Egg has got the same kind of property. It's a very good exfoliator, and it will work. So there are a few other things you can use, like lemon and yogurt is really good mixture as well. And yogurt sometimes helps better because it is going to give you this coolant effect, and this burning and sensation will go away faster. So you can try that similar proportion, or if using one proportion of lemon with any of the other thing you feel it's still giving you burning sensation, then just increase the amount of whatever other diluent thing you're adding with it, and it will work. So there are so many other ways to use lemon, which I'm going to catch up in the next episode, which is going to be next Saturday. And tomorrow we're going to cover skin and diet, and what else we can do. Until I see you next time, look after yourself and have a very lovely weekend.